Welcome back, Chronics, and thanks for joining me. Today we're just going to talk all about bladder problems. I'm going to do a shortened version of the presentation I did at the EDS conference. Still waiting for the other videos to come in so I can do episodes on those, but I thought I'd start with mine. When we're talking about bladder problems, it can be divided into three main categories: gotta go, can't go, and ouch. Meaning overactive bladder, underactive bladder and retention, and pain. Women with EDS are 4 times as likely to have incontinence problems because it just keeps getting better. Every single time I read about something, these are all the tests you should have, so they have some kind of clue. We have 2 kinds of incontinence. We have urge incontinence and stress incontinence. Urge incontinence, you're going more than 8 times a day. At night, you're going more than 2 times a night, which is also called nocturia. If you also have POTS, you have a nervous system issue, we'll call it, meaning our nerves do what they want when they want. So we could have something called a neurogenic bladder because our nerves are affected. They don't know why. All of a sudden gets activated, then we got to deal with the repercussions. First line therapy for incontinence: avoid all bladder irritants. What do I mean by that? Chocolate, corn syrup, alcohol, seltzer, citrus. Basically anything that brings you joy in your life is a bladder irritant. Maybe get some pelvic floor training if that's what your problem is. Second line therapy would be these medications with all of these side effects. Yeah, I just looked at it and was like, that just looks like a typical Tuesday. Why would I want more of any of that? With this category of drugs, 70% of patients stop it within the first 6 months. Third line therapies, another group of drugs that has very few side effects, allegedly. You can do sacral nerve stimulation, peripheral tibial stimulation, which is when you use the TENS unit and you put it on 2 areas that are on top of your tibial nerve. And the idea of being, if you overload that nerve, it will kind of reset itself, like a computer. Then you can always Botox your bladder. These are all the symptoms of retention. There's just a few. Here are the reasons for retention. These are the medications that can cause retention. So, I mean, just looking at this list quick, I see 3 or 4 that jump out at me that I take. So definitely go over your med list if you're having retention issues. Treatment for this: you can drain the bladder via catheter. There are medications. They can give you something called a pessary and pelvic floor physical therapy. Painful bladder syndrome. Let's just call it IC. These are the reasons. Again, the treatments are very similar to the treatments for incontinence, just in a different way. For example, they're going to give you a pain medication if you have a UTI. This one's my favorite, the stretching of the bladder. I have questions. And some more good news for the ladies. Put your hands in the air like you don't care, but we do care because it sucks. So they did a study of women with hypermobility syndrome disorder, or EDS, and out of 22 women, only 10% of those women had positive urinalysis. So even though all of them had an infection, only 10% showed up on a culture. And why is that, you ask? Bacteria can hide inside our bladder walls, so that's cool. The main enzyme that metabolizes histamine on us is a little not right, if you know what I mean. Also, we have less of a protein that's important to our immune system, of course. Good news, there's a UTI vaccine that pretty much covers you for 9 months after taking it as a pineapple spray under your tongue for 3 months. It would be really useful for those of us who can't take a certain group of antibiotics. The FDA had originally approved the one from Spain, but then we had an American company that did a similar vaccine, so once they got through the first round of trials, they made that available to us only if the UTI is going to be life-threatening. Really? If any of you are suffering with chronic UTIs, I would write to this company and be like, hey, what's up? And why don't you want to help me? As always, Chronics, thank you for joining me. And remember, don't give up, stay strong, and don't take crap from anyone. I will see you guys next time.